If you've been told that your blood pressure is high or you're already on medication for it and you're wondering whether there's anything else you can do, then I'm really hoping you'll find this video very useful because there's something that I think most people with hypertension are actually never told. The lifestyle interventions that are backed by proper clinical trial data can actually lower your blood pressure more than most of the medications that we have. I'm talking about specific quantified interventions with specific quantified results. And in some cases, the numbers are bigger than the drug. So what I'm going to do in this video is actually go through the most commonly prescribed blood pressure medications that we have one by one and tell you how much each one lowers your blood pressure by on average according to the best available evidence, and then tell you what the research shows can do the same thing or even more without a prescription. And let me just say right at the beginning that these numbers come from different trials and different populations. So they aren't perfectly head-to-head comparisons, but they do give you a very good sense of the magnitude of effect that each intervention can achieve. Hello, I'm Dr. Alex, and I've spent nearly a decade working in emergency medicine across the NHS. And high blood pressure is something that we see the consequences of literally every single day. Talking about heart attack, strokes, heart failure, kidney failure, and with high blood pressure, it is largely silent until something significant happens. And the really frustrating thing about all of this is just how much of it is driven by factors that are within your control. So, I really hope you get something valuable from today's video. And let me just say really quickly that only about a quarter of you watching these videos are actually subscribed to the channel. So if you find these useful and you'd like to support what I'm doing here, then the best thing that you can do is hit the like button and subscribe. It really does make a massive difference, right? So let's just quickly set the scene then. So high blood pressure or hypertension affects around 1 in 3 of us, 1 in 3 adults. And we call it the silent killer because most people have no symptoms whatsoever, no headaches, no dizziness, basically nothing unless your blood pressure is critically high. We're talking about 180, 200, 220. At that point, most people feel completely fine, while the elevated pressure is quietly damaging your arteries, straining your heart, and increasing your risk of stroke and heart attack all the time. Now, the target that we give for most people is below 130 over 80 millimeters. Mercury, that's the measure, that's the unit that we use for blood pressure, mmHg, but ideally it should be lower than that. And when lifestyle alone isn't enough, then yes, medication is really important, and it honestly does save lives. But here's what I want you to understand for this video. The average blood pressure tablet lowers that top number, the systolic blood pressure, by somewhere between 8 and 12 points. And hold on to that number, 8 and 12, because we'll come back to that number repeatedly. Okay then, so let's start with a class of medications called ACE inhibitors. So we're talking about things like ramipril and lamopril. So these are probably the most common medications that we prescribe. Or maybe that and amlodipine as well. But these ACE inhibitors work by blocking a hormone system that causes your blood vessels to tighten, allowing them to relax, and the pressure inside them to fall. So a Cochrane review, which is the gold standard of medical evidence pooling data from multiple studies, found that ACE inhibitors as a class produced an average reduction of around 8 over 5. They also found no meaningful difference between individual ACE inhibitors. So ramipril and lamopril are essentially doing the same job to the same degree, if that makes sense. Now, the original DASH trial, published in the New England Journal of Medicine, randomly assigned people with elevated blood pressure to either a control diet or the DASH diet. So DASH stands for Dietary Approaches to Stop Hypertension, and it's basically just a whole food pattern high in fruits and veg, low-fat dairy, whole grains, and nuts with small amounts of saturated fat and red meat. In people who already had hypertension at the start of the trial, the DASH diet alone produced a reduction of 11 over 5.5 compared to the control diet. And that's without touching sodium intake, specifically without weight loss, just the dietary pattern alone, and that is better than the average ACE inhibitor. That is better than Ramipril, which we prescribe all the time. No prescription, no dry cough, which affects a significant proportion of people on ACE inhibitors and a larger reduction than the medication. Now, the key word here is consistently. So this isn't about eating a bit more veg or a bit more fruit. It's actually genuinely shifting your dietary pattern towards what the DASH diet actually involves. And you can read a bit more about it in the description below by clicking on the link. Moving on to amloin now. So this is again one of the most commonly prescribed blood pressure tablets in the UK and the US, and it belongs to a class called calcium channel blockers. And basically what it does is that it relaxes the walls of your blood vessels so they're less constricted, reducing the pressure inside them. And I did a video on this exact drug, specifically on amlopin, a few days ago, and this is one of the most popular videos that I have ever done. So clearly a lot of you are taking this medication. Now, an independent review found that amlopin produces a reduction of about 12/7 on average, and that's actually one of the stronger effects among these commonly used drugs, which is why we use it so often. Now for Loteen, the intervention that I want to talk about is aerobic exercise. So multiple large meta-analyses have actually looked at what regular aerobic exercise, brisk walking or cycling or swimming does to your blood pressure in people with hypertension. Across this evidence, the consistent finding is a systolic reduction in the range of 7 to 12 points, with multiple studies actually reporting reductions at the top of that range in people who start with elevated blood pressure and hit around 150 minutes of moderate activity per week. And there's another review that found average reductions between 6 and 12 points across these different trials. Now, at the upper end of that range, this directly matches amlopin, and the dose of exercise here is not dramatic. We're talking about hitting the activity guidelines that most people already know they should be hitting. So this isn't, running a marathon a day. This is basically just 20-30 minutes most days if you can achieve that. This drug, amlopin, is pretty well tolerated, but it does cause some ankle swelling in a significant number of people, and some people do get some flushing or some headaches with it as well, but most people tolerate it just fine, and these effects do wear off after a while. But the thing is, regular aerobic exercise causes none of those things, but it also improves your fitness, your mood, your metabolic health, and your overall cardiovascular risk in ways that amlopin simply doesn't. Okay, moving on to Larten and Candesartan. And these are both what we call ARBs, angiotensin receptor blockers, which work in a very similar way to the ACE inhibitors at the beginning, but through a slightly different mechanism. And importantly, they don't cause that same irritating cough that a lot of people get when they take ACE inhibitors. So the Cochrane data puts ARBs as a class at a reduction of around 8/5. And at this point, I want to focus on weight loss because the numbers are really, really compelling here. A meta-analysis found that blood pressure falls by roughly 1 point for every kilo of weight lost. That is, if you are overweight and you actually need to lose some pounds. And that sounds a bit modest, but if you follow the math, losing 8 to 10 kilos, which is entirely achievable with sustained dietary change, gets you 8 to 10 points off your systolic blood pressure. And that equals or even beats the average ARB. And the thing is, weight loss doesn't do this through just one single pathway, the same way that one of these drugs does. It reduces your circulating blood volume, it improves your insulin sensitivity, it lowers the activity of the renin-angiotensin system, which is the exact same system that the sartan and candin are blocking pharmacologically. Basically, it's affecting the underlying biology here. It's not just blocking one receptor downstream of it. Indapamide is another medication that I'm sure lots of you watching this will be taking, and this is what we call a thyroid-like diuretic, basically a water tablet. And the way it works is by making the kidneys excrete more sodium and water, reducing the fluid volume in the circulation, and then bringing that pressure down. The data puts these medications at a reduction of around 9/4. And for indapamide, I want to talk about sodium reduction specifically because the numbers in the right populations are really interesting. The DASH sodium trial compared people eating either a high sodium diet or a genuinely low sodium diet as part of a controlled trial. In people who already had hypertension, cutting sodium intake from high to low was associated with a systolic reduction of around 11.5 points compared to the high sodium control group. And that number beats indapamide, not a medication, not a supplement, not a procedure, just reducing the amount of salt going in. The average person in the UK gets most of their sodium from processed foods. We're not talking about adding salt to your foods, talking about the sodium that's already in these industrially formulated foods. And what it comes down to for the vast majority of you watching this will be cutting out ultra-processed foods as much as you can. Okay, moving on to bisoprolol now. So bisoprolol is what we call a beta blocker, and it works very differently from the others in this video. So rather than acting on your blood vessels or your kidneys, it actually slows the heart rate down and reduces the force of the heart's contractions, which then brings your blood pressure down. And the data here puts bisoprolol at a reduction of around 10/8. And for this section, I want to talk about weight training or resistance training. A meta-analysis published in Hypertension Research pulled data specifically from randomized control trials looking at resistance training alone in people with hypertension and pre-hypertension and found a reduction of 8/4 overall. But crucially in the group with actually established hypertension, this systolic reduction was actually 10 points, and that matches bisoprolol. And the benefits, obviously, and I talk about this all the time, they go far beyond just blood pressure. Resistance training builds and preserves your muscle mass, which is so important. It improves your insulin sensitivity, it reduces your visceral fat, and it's one of the most powerful things that you can do for your metabolic health and your long-term functional independence. I've done lots of videos on this, and this seems to be a topic that lots of you are actually interested in. Now, beta blockers, as with all medications, do have some side effects. They can cause fatigue, cold hands and feet, reduced exercise tolerance, and in some people, some low mood as well. And you know what I'm going to say? Resistance training does the opposite on all of those fronts. The final medication on the list is something called spironolactone, and this is what we call an aldosterone antagonist. It blocks a hormone that tells the kidneys to hold on to sodium and water. So if you block that signal, then fluid volume drops and so does your blood pressure. Now, it's typically used as a fourth-line agent, meaning it's added when somebody's already on lots of different medications and their pressure still isn't controlled. So the people taking it often have genuinely stubborn, difficult to treat hypertension. The data puts spironolactone at around a 9 to 10 point reduction in systolic pressure. And let's just pause and zoom out for a moment, because across this video, I've shown you what individual lifestyle interventions can do. We've talked about the DASH diet on its own. We've talked about weight loss on its own, aerobic exercise, resistance training on its own, and each of them individually, they rival or beat a medication. But what happens when you start combining them? This is where something really remarkable starts to happen. So the ENCORE trial, and I'll put a link in the description below, the ENCORE trial, funded by the NIH and published in the Archives of Internal Medicine, took overweight people with an above normal blood pressure and put them through exactly that combination. So the DASH diet, structured aerobic exercise, and a behavioral weight management program all together. And they did that over 16 weeks. The result was a reduction in blood pressure of around 16/10. 16 points off the top number and 10 points off the bottom number. And just sit with that number for a second. 16/10. Because that is not only more than spironolactone, it is more than most people get from taking 2 blood pressure tablets at the same time. 2 drugs, and this lifestyle program beat that. No prescription required, no cost required, no side effects. And this wasn't some extreme research protocol. It was a structured dietary pattern, regular exercise, and supported weight loss. Three things that individually we already know move your blood pressure meaningfully. And when stacked together, they produce a reduction that most people would assume is simply not possible without a drug. And let's just go back to spironolactone for a minute. So this has a really meaningful side effect profile that can actually raise your potassium to dangerous levels. It affects your sex hormone pathways and it causes breast tissue growth in some men. And as a result of all of that, it requires regular blood monitoring. Some cardiac arrests that I've seen in my career have been caused by a raised potassium level when people have been taking this medication. Now, obviously, the Encore program has none of these risks, but what it does require is commitment, consistent dietary change, regular exercise, and sustained weight management. And yes, for some people this won't be easy. It will be difficult, but the biology is unambiguous about what it's capable of. This is achievable with the right support and guidance. So what does all of this mean then? Well, let's just zoom out for a moment. Across 6 of the most commonly prescribed classes of blood pressure medication in the UK and the US, we have specific lifestyle interventions, each one backed by randomized control trial data that can produce comparable or greater reductions. The DASH diet beating ramipril and linaprazole, aerobic exercise matching amlopin, weight loss matching or beating ARBs, sodium reduction beating indapamide, resistance training matching bisopril, and a combined lifestyle program producing a reduction that beats 2 tablets taken together. These are not small soft lifestyle tweaks. You know, a casual eat a bit better and go for a walk won't do this. The interventions that produce these numbers are structured and deliberate and sustained, but they absolutely are achievable for the vast majority of you watching this video. And here's the really critical thing about lifestyle versus medication that I want you to sit with.